If you have trouble getting into a deep squat because hip flexion hurts, I'm going to show you the gentlest exercise you can do to improve your range of motion for hip flexion. So if you find that even bringing the knee to the chest is really blocked somewhere in your hip, either at the front or the back, this video is going to help you out. And make sure you stay tuned to the end so I can explain how this also pertains to back pain and not just hip pain and you poor people out there who have been given that scary hip impingement diagnosis. So if you're ready, let's get ready to think right, move right, and feel right. And before I forget, Boney wants to know what brought you to this video in the first place. Why are you thinking about improving your hip flexion? Is it because you have hip pain in daily life, or is it affecting your sports performance, or is this just some sort of sick voyeuristic schadenfreude? Drop us a comment down below.
Before we jump right into the exercises, we need to talk about some basic philosophy first. One way to think about your problems with hip flexion is to say, well, my body's just not made for hip flexion, so I just can't do it and I'm not even going to try. That's not going to get you much in the way of results. The second way to think about it is like I'm thinking about my handstands and cartwheels. If they're uncomfortable initially, it's not because my body's not made for it, it's because my body's not trained for it. So if I expose my body to something like an inverted position, gradually and safely, and at an intensity level that it can handle, then my body can adapt, get stronger, and get better at the position that I'm exposing it to. In the same way, your hip flexion can get a whole lot better if you're patient and if you use some gentle exercises first and then gradually bump up the intensity. Well, I am hoping that eventually I'll be able to do a handstand, but that's not what we're here for. We're here to help you get hip flexion, meaning bringing the femur closer to the chest. So what you're going to do is just lie down on the floor, and you're going to bring your leg towards your chest slowly and carefully. Do not wear skinny jeans while you're trying to do this. If they are too tight, they will not allow you to get full motion, so make sure your pants have stretch or they're loose enough and baggy enough to allow you to pull your knee towards your chest. Now, there's a couple problems that might show up right away. Number one is if your hip flexion is really bad, you're not even going to be able to reach here. You might get your pant and pull this way, that's fine, or you might need a belt or a strap or even a towel to just loop under your leg so that you can then start pulling up towards your head, towards your face. Do this slowly. Your goal here is not to jerk it as fast as you can. This is not that kind of YouTube channel or OnlyFans page. I don't know what you call this. Anyway, you're going to be slowly going until you hit the end of your range, and then you're going to hang out there just a little bit. Now, ideally, you want to stop where you feel the sensation in your butt. You don't want to feel it right here in the front of your hip. So if you feel like it's jamming in the front of your hip, you've probably gone too far. Back it out and then feel for sensation here. It might be subtle at first, but you're probably going to start to feel it right back there as being the limiter, because the muscles here actually halt your ability to pull this direction, right? These muscles are here, they attach here to the back/bottom of your femur, and they would stop the ability to move. If you give them time, they will actually lengthen. So we're doing a really gentle glute stretch. Now, once you are in a position where you feel just a little bit here, no jamming here, what you can do to make this more effective is push against the resistance. So you're using these muscles to go down, like I'm going that way. It's like I'm trying to kick down or pull back down. My hands, though, are going to resist. So I'm firing up those butt and kind of some hamstring muscles, and then I'm going to relax and then see if I can go just like a millimeter or even half a millimeter further, but still comfortably. So if you feel like I'm going an extra millimeter but it's hurting and jamming, you stop, okay? Just hang out in the angle, in the position you can get to, and then fire the muscles again and just get all your hip muscles used to controlling that position. And over time, you're going to notice those muscles feel safer there, your whole body feels safer there, and then you're able to go a little bit further. But don't rush it, don't try to force it into the position. Just make sure you're constantly feeling these muscles
adjusting to the position, okay? Another thing you can do is switch up the contraction. So you can take your hand and then create resistance. So now you're firing the hip flexor muscles to pull in towards your face, okay? So you're creating more hip flexion and you're just getting them used to the coordination, figuring out what they need to do and how they need to be in relationship to one another when your knee comes closer to your chest. Now, another thing you want to think about when you're doing this is leg position. Just a quick interruption to remind you that if you are looking for a comprehensive program to retrain and rebuild your hips at home, go to uprighthealth.com/HH to check out my Healthy Hips program. It is money back guaranteed. It's packed with exercises, stretches, and strategies to help you get your hips feeling comfortable and healthy. Again, it's at uprighthealth.com/HH. Go check it out when you're done with this video. All right, let's get back to it. So for many people, myself included, when you first start doing this, you're gonna notice like being here at the midline is kind of impossible and maybe really painful. So instead of being at the midline, you can be out at the side, right? So you're coming up at the side. Everything else is the same as what I just explained, but your hand and arm position might be a little bit off to the side rather than at the center. So you might be over here, right? Or maybe even over here if that's what you got for now. If you don't need the strap, you just have your hands around the front of your shin or under your thigh and you just start pulling in, contracting, using those muscles. Count to 3 to 5 or longer once you get used to this. Relax. You can do the opposite side, firing those hip muscles in the front, and then relax. You're gonna notice also that one side is better than the other side. My left side is really stiff this morning because I was out dancing and I just didn't have time. Well, I had time to stretch, but I didn't stretch. Anyway, let's not talk about regrets we have. Let's work on this. So now I'm in this position. I'm gonna fire it this way. You can do this with me and then relax it. Now, one thing to think about is this, right? It's here, not your low back. So if my hip gets jammed in a certain position, like it's right here, and it feels like I can't get any more motion from the hip, the cheat is to just tilt the whole pelvis or do something to get the whole low back involved or to abduct. So the leg might sneakily head out to the side. And this left leg for me has been the one that really likes to cheat, which has led to some issues, which I will talk about in the director's cut of this video, which I will make available on my Patreon page, which you can find at patreon.com/uprighthealth. I've got all kinds of exclusive stuff over there that you should totally check out, including a full-length version of this video where I'm going to talk a little bit more about how this stuff has personally affected me. But since we're on YouTube, you probably don't want to hear all that. But if you do want to hear all that, head to my Patreon page. In any case, work on creating more options for yourself. So if you are starting off here and you're really restricted, fine. Start working on bringing in more hip flexion in this abducted position. And then over time, you want to also work on getting it in this midline. And then, do you suppose we could go beyond the midline? The answer, my friend, is yes. I have personally found it's kind of tricky trying to bring it across the midline because the stretch sensation here can be a little subtle and my back and my pelvis want to start twisting to avoid the stretch here. So a couple key things to remember are to think about the side of your pelvis staying pretty close to the floor. You don't want your whole butt to roll off unintentionally and then shift the stretch into kind of like a back cracking sensation. We want to keep the sensation all back here around the posterior side of your hip, your glutes, and your glutes. Okay, so be slow about it, be gentle. Right here, I can feel like, okay, it's getting into the back of the hip. And then you can also think about pushing the femur back a little bit. You can think about that kind of vector going down the way the femur is pointing, and you can also think about a vector that goes down towards the floor, like you're dragging your knee down that way. That's going to massively challenge the muscles of the posterior hip. And when you're ready, you can think about adding the hip flexion, so then you're bringing it up that way. Now, I know that's a lot of different vectors and directions to think about, but you want to have the ability to handle all of those vectors so that this whole thing feels more comfortable as you go into flexion. Now, another option you have that I really, really enjoy is adding an intentional twist to the pelvis. I know I just said don't do that, but as you get more advanced, you can do this. Just getting into whatever angle feels like it really pressures those muscles, and then having those muscles work against that force. So now I am pulling down towards the floor, okay? So knee is dropping down. The hip muscles here, I can feel the stretch in the posterior hip. Now I'm lifting my knee up against my hand, forcing those muscles to work, forcing them to get used to the position. Then I relax, and I'll just do this 3 to 5 times. I might do them for long holds to get some fatigue. This is the key to getting your hips used to being in these deeper hip flex positions in a gentle, safe way. You can absolutely do other exercises as well, but these I find are great for doing the deep, detailed work where you might not be able to aim a stretch in just the right way without that fine control that your hands and arms give you and all these different options you have when you're lying on the floor. So, quick recap. You're going to be lying on the floor. You're going to bring one knee towards the chest like this, slowly and gradually. If you can't do it with your hands on your leg, then use a belt, use a strap. If you want this to be more stable, this leg can be bent and the foot planted. But if you want to accentuate more hip flexion on this side, then straighten that out. As long as it doesn't create a little twist or something in your pelvis that cheats you out of the specific angle you're working on. So it's not wrong to do it this way. It's not wrong to do it this way. Do whatever helps you find the angle that you want to work on. Use contractions so you can find them in all kinds of directions. You can be pushing into your hand here. You can pushing into your hand here. You can push down and out. You can do all kinds of things. You can even have your hand under the knee here and push in and work your adductors. All of these options are available and they're free. You can be pushing this way, working your hip flexors. All of these are going to help you master the position of hip flexion in a safe, gentle way. Do 3 to 5, and if you feel like you can do more of these contractions, go ahead. Just do them. Do them until you feel a little bit of fatigue, and then make sure you do the other side and see how they compare. If one side is obviously weaker or more restricted than the other side, spend extra time on that stiffer, more restricted side, like I should have done last night. And of course, there's the age-old question of how often should I be doing this stretch to improve my hip flexion? The answer is at the beginning, remember that slow is safe and fast is foolish. Take your time, just do it twice in the first week, Monday, Thursday, Tuesday, Saturday. And if that felt totally fine, you're not crippled with soreness, then you can start to bump it up 3 times a week, 4 times a week. If you know your body really well and you can feel that, yeah, this is gonna be no problem, I'm gonna do this every day, totally fine. It's okay to do that if your body feels like it can handle it, it can tolerate it, and it is feeling like it's improving your range of motion. If you do it one day and you wake up the next day and it's super duper 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 sore and you don't really think like you should do it again because something might pop, snap, crack, or just not feel good at all, then guess what? You are correct. You should not. So listen to your inner voice. You got to calibrate that so you understand how to train your body safely over time. Also, after you're doing these stretches, you might feel like your hips are a little bit too primed for hip flexion. You might feel like it's kind of hard to go into hip extension afterwards, in which case it might be a great idea to do some quad stretching, some hip flexor stretching to open it up. Then you'll be opening up range in this direction and in the other direction, and that can help you out big time. The key idea here is to build options for your body. If you have poor hip flexion, you're going to compensate throughout your life by getting flexion in your spine. And while that's not going to kill you or give you cancer, there are times where that is going to predispose you to injury. If you're trying to pick something up that's really heavy, or you're trying to do something like practice cartwheels or whatever, and you just can't control your spine and your hips well, you are going to increase the odds that you get hurt. And the same thing is true for your hip flexors. If they are too stiff and they don't allow you to get hip extension, you are going to get extension from your low back, which can also cause issues if you're trying to do things like dance, lift weights, sing, I don't know. I'm out of ideas here. Give me some ideas. Drop me a comment down below. Anyway, the point is you need your hips to be healthy in order to do fun stuff with your body without getting hurt. So I hope this gentle hip stretch helps you improve your hip mobility and helps remove any fears you have about having something scary sounding like hip impingement. If you'd like a comprehensive program to help you with your hips, I invite you to check out my Healthy Hips program at uprighthealth.com/HH. I'll have a link in the description box as well. And if you want daily inspiration to help you with your hips, to give you ideas, give you some motivation to keep training your body, your shoulders, your hips, your knees, whatever, then be sure to go to patreon.com/uprighthealth. I post exclusive content there to help you and me stay accountable so that we can keep building our bodies. I've got private podcast episodes, I've got ad-free videos, and I've got videos that I film in my garage gym, notes about what I'm learning about my own journey that I share only with my Patreon patrons. So if you're interested in that, make sure you head over there. Link will also be in the description box. If you found this video helpful, drop me a comment, hit the subscribe, like buttons, whatever, share this video. And as always, I hope you remember that pain sucks, life shouldn't.